Today, I am going to answer for you one of the most common questions I get about nursing school, which is, how do you memorize everything in nursing school? I'm Nicole Whitworth. I'm the founder of Your Nursing Tutor, and I have been a professional nursing tutor for over 12 years. I specialize in helping students bridge the gap between being a want-to-be nurse all the way to being an expert nurse by training you how to study in a way that trains your brain to automatically think like a nurse. So, how do you memorize everything in nursing school? It really comes down to learning one difference. Okay. The difference is what information should you memorize and what information do you need to study another way? Because the shorter answer is, how do you memorize everything in nursing school? You don't memorize everything in nursing school, but you do need to pass your classes. There's different ways to study that are going to help you be more successful so that you can be a successful nursing student instead of one of the nursing students who struggle constantly through the program as things get harder and harder. If you can master this difference, then you will be one of the students that nursing school gets easier and easier for, just like any new skill that you're learning. It should get easier as you practice. First thing that you want to think about when you're differentiating whether you should memorize it or study it a different way is if it's a one-off or a straightforward fact. So perfect examples are going to be lab values or vocabulary definitions, things like that, anatomy and physiology. Then you want to memorize it. Flashcards are great for this. So in fact, this is the only thing I recommend flashcards for. If you're using flashcards to try to memorize all of the facts in pharmacology and about all the characteristics of drugs and mechanisms of action and everything, then pharmacology is going to remain difficult for you because that's much too complex information to put on a flashcard. So you want to focus on memorizing things that are very straightforward, like a one-to-one correlation. If this, then that. You can flip over the flashcard and have it. It's got to be the very simplest baseline foundational type of information. That's the stuff you memorize in nursing school, and that's not too overwhelming, okay? Two is the complex information. This is the stuff that when you try to memorize it, you're going to feel overwhelmed because you can't, okay? You might feel like you can for the exam, but you're not going to retain it long term because you don't actually understand it. It's not the type of thing you can just straight up memorize. So examples of this more complex information is going to be groups of information. So for example, signs and symptoms of a disorder. Those kind of things you need to study for understanding, not for memorization. So I'll give you a further example. So you want to figure out like what the underlying anatomy and physiology or pathophysiology is that causes this group of signs and symptoms, for example, so that you can understand why they occur versus simply trying to memorize them without knowing why they occur. Because you know that if you have a list of symptoms for disorder A and a list of symptoms for disorder B, when you get to an exam and you're saying, patient has these symptoms, what are you going to do next? Well, you have to know what disorder those symptoms represent in order to be able to figure out what you're going to do next. But if you just had these two generic lists of symptoms in your head, they're going to get mixed up. And this is the reason why nursing students can narrow it down to two answer choices and then always pick the wrong one. Because it's one of these two that you're pulling from, but it's a little fuzzy on the details because you memorized instead of understanding. Instead, if you go through and say, well, the normal A and P does this, but because X is broken, this is what's going to happen we're going to see these kind of symptoms because it's not working properly. And this is what happens when it doesn't work properly. Then when you get to that exam question, the correct answer is literally going to jump out at you. It's going to be so obvious because you understand it. And you didn't even have to memorize any of those symptoms because they just made sense to you because this is what happens when it's broken. Okay. I promise you, if you study this way, and I actually created a four-step process I call the silver bullet study system, just to explain to nursing students exactly how to study this way so that you learn to understand the more complex information because, spoiler alert, this is what it means to think like a nurse. That if you study this way, then you won't even need an NCLEX review course at the end of nursing school because you will remember everything that you studied forever. You don't forget the stories that you're telling yourself with the A and P and what happens next and figuring out and taking the time to wrestle with the information and understand it. And so that is how nursing school gets easier instead of harder when you study the complex information for understanding and save the memorizing for the simple facts. Now, if you would like some help learning how to tell the difference between the simple facts that you should be memorizing and the more complex information that you need to understand, and and even if you would like some help you studying that complex information in a way that's going to automatically train your brain to think like a nurse, then I would love to help you with that through my VIP tutoring membership. And you can find more information about that at yournursingtutor.com/VIP.